Hello, Namaste everyone. I am Dr. Janardana V. Hebba. I am the founder of easy.com. I welcome you all to this special class on mucormycosis. After Corona got a little bit out of control due to decreased immunity due to the virus itself or due to the heavy use of steroids and antibiotics. Due to many reasons, this mucormycosis of black fungus, which is called in general common language, that came into the scene, and suddenly there were many cases because the second wave of corona hit us very hard. Ayurveda community people, Ayurvedic doctors were also given a chance to treat these rare cases. And many people, many out of this effort, many new stars were born in Ayurveda. So we have one such star with us, Dr. Rajnikant Patel.
Okay, so first of all, good evening to everyone. So I bow down my head to Lord Dhanvantri, who has created Ayurveda. So why Ayurveda is like a nectar, and why we should feel this in this present time. So we have observed that in recent time, all over the world, modern science were facing much difficulties in treatment of COVID-19 and mucormycosis that we all have seen. All the government all around the world are struggling. We can see they are struggling to treat for treatment of COVID-19 and mucormycosis. So at that time, Ayurveda emerged as a life savior for so many patients. We have see in India so many hundred thousands of Ayurveda practitioners has treated COVID-19 with the use of Ayurvedic medicine only, that too according to Ayush guidelines. So this is the Ayurveda. So everywhere people were dying. There was no good enough treatment at that time. So many doctors have saved so many people's lives with COVID-19. So this is the reason why I have used Ayurveda Amruta Nam. So this is the practical thing we can say Ayurveda is nectar. Okay, so before we go to Ayurvedic view of mucormycosis, I would like to present 4-5 slides about WHO, World Health Organization, their view on mucormycosis. So according to WHO, recently many people with COVID-19 have diagnosis with mucormycosis, and that is not 100% known that it is due to COVID-19 or some other reason. There are many hypotheses all around the world. This doctor are giving. Some is telling this is the COVID-19 that is causing this mucormycosis. Someone is telling high D dimer in the COVID-19 that is causing a D dimer. Someone is telling due to low immunity this mucormycosis is happening, but they don't have exact 100% clear data which can prove the reason of mucormycosis. Okay, so how does this infection spread? So normally we found in environment this mucor fungal spore will be there in everywhere in the environment. People like you and me who have normal immune system, who doesn't have low immune system, their body fight with this fungal spore and they don't create any disease. But what happens when person with weak immune system inhale those fungal spore? At that time, fungus growth in their airways. That might be in nasal mucosa. If it go further down, then it grow like fungal ball in the lungs. So when you do the CT scan of lungs, they write like a fungal ball. We can see the ball-like structure in the lungs that is created by fungus. One more thing importantly is this is not the contagious disease. This doesn't spread from one person to another person. And in a very rare case, skin infection occur. So I think 400 cases of mucormycosis. In that, only 2 patients I have skin mucor, that is cutaneous mucormycosis, and rest all are the rhinocerebral, rhinoorbital, or rhinomucormycosis. Right, and rarely gastrointestinal mucormycosis we see. I haven't seen till now a single case. Okay, so how to recognize the mucor? So the initial symptoms will be swelling of the eyes and around the eyes, usually on the one side. Now this is the main feature. Everything, any manifestation in the face, there will be unilateral, or hardly or rarely we will see both sides are getting involved. So facial pain, headache usually on one side, red eye that is also on one side. Another point to be note is oral cavity examination. When you ask patient to open their mouth, we will see a rangoli type of feature, black dots on upper palate or gums like that, and a fever. So main things to remember here is it will be present on only one side. Unilateral presentation will be there. Either one eye will be involved like that. Okay, so how to diagnosis is as per the modern science. So first things they do is they do a diagnostic surgery to confirm whether it is mucormycosis or not. They will do a surgery. Then they will take a tissue from the nasal mucosa. Then they will do the biopsy. So that is the one way to diagnosis this mucormycosis. Another way is they don't go for biopsy. They do the CT scan or MRI or they do the nasal endoscopy. So these are the method to diagnosis in the modern science. Either they take a tissue, they do biopsy, culture, or they do the CT scan or MRI. Okay, next. So what is the treatment in the modern science? So simply for everything antibiotic, antifungal, antiviral. This is a fungal disease, so they have antifungal called amphotericin, posaconazole, or other class of antifungal drugs. Surgery is the most needed part. So their first option is to do the surgery without delay. They don't even delay for 2 or 3 hours or 6 hours. Once they see the patient, immediately they have to cut and debridement that part. That is such a that much severe this disease is according to modern science. So how can we protect ourselves from getting the mucormycosis? So we have to avoid such buildings or area that is damaged by water or maybe cyclone or flood. Then we should also avoid area with a lot of dust like construction site, labor work are there. Then we must avoid contact with the soil. We must wear full cloth which should cover our full arm and legs. And if we get any skin cut, then we have to immediately wash that area with soap and water. These are the protective measures we can follow. Okay, so that WHO part according to means introduction of mucor is finished. Now we are going into the subject. So types of mucormycosis, that is divided or based on the organ involvement. Here I have write it can be rhino-orbital cerebral. So here we can take three types. Either it can be rhino-mucormycosis, either it can be orbital mucormycosis, either it can be cerebral mucormycosis, or it can be rhino-orbital mucormycosis, or it can be rhino-orbital cerebral mucormycosis, where nasal mucosa is involved, eye is involved, and brain is involved. That is the rhino-orbital cerebral mucormycosis. Majority of case we see only nasal involvement is there. So we say them rhinomucormycosis. In if it is further invading from nose to eyes, then we say rhino-orbital mucormycosis. From orbit it is spreading to brain, then we say them rhino-orbital cerebral mucormycosis. If it is going downwards, if it is getting infected in lungs, then we say it is pulmonary mucormycosis. If on skin tissue we are finding the this mucor-fungal spore, then we tell them cutaneous. If it is in intestinal system or other part of GI tract, then we tell them gastrointestinal, and the last one is disseminated. So this is the patient. This photo here down you see this is the thigh muscle back. The whole is infected with mucor patient. Among the two patients, this is the one patient I have of this skin mucormycosis. This is the cutaneous mucormycosis. You can see how extensively the debridement they have done. Complete they have taken. Still the biopsy is positive for mucor fungal spore. Okay, so the subject all are waiting for what Ayurveda understand according to its own view about mucormycosis. Okay, so after taking first case of mucormycosis, I have studied all the Laghutrayi, Bruhatrayi in depth. I have read Pratishaya, I have read Kshudra Roga, I have read Shirogata Roga, everything I have read which can be fitted in the mucormycosis. By conclusion of all these things, I have fit mucormycosis in these 6 probable disease. So we can say these are the 6 disease where we can exactly fit the mucormycosis. So first we see the Kaphaj Krumi that has been taken from Sushruta Samhita Uttar Tantra 54th chapter and 14th slok. The second one is Kushtha, that is from Charak Samhita and also from Sushrut Samhita. Third one is from Asthi Majjagat Kushtha. So when the Kushtha is getting invaded in the Asthi and Majja Dhatu, there we see the symptoms like mucormycosis. That is explained by Sushruta and Nidan Sthana, 5th chapter of 25th shloka. Then another Sushruta reference we have Krumi Janya Shiro Roga, the microbial infection of the head or the headache caused by the worms. That is also from Sushrut Samhita. Then we have a concept of poison, Dushi Visha. So we take a steroid, we take a high dose of steroid, high dose of remdesivir, like so I count them in Dushi Visha. So that we will see how we can exactly interpret it practically. Then sixth one is Rakta Jakrumi. That is the infection of the blood. That is from Charak Samhita. So here you see maximum reference I have taken from Sushrut Samhita. Okay, though that those six point we will take one by one in detail. Krumijanya Shirorog. So in Sushrut Uttar Tantra, it is written that Nistudyate Yasyam Shiro Ati Matram Sambhakshamanam Sputata Iva Cha Antah Granahascha Gashtit Salilam Sa Raktam Shiro Abhitapah Krumi Bihi Sa Gorah. So this yellow color words you focus Sambhakshamanam. So when in this person feel that said that something is eating inside his nose, he feels some insect is eating their tissue. Then granascha gastet salilam cha rakta. So this is the nasal discharge of pus and blood. And last word is Goraha, that is the deadliest disease. So these three symptoms you see which are written in yellow words, that is we can correlate with cerebral fungal abscess, or we can correlate with intracranial extension of mucormycosis, or we can correlate with skull base osteomyelitis. So this Krumijanya Shiroga, this comparison with mucormycosis, classical reference I have given. Okay, the important point, Asthi Majjagat Kushta. When Kushta is getting lodged in Dhatu, and that too in deeper Dhatu, deeper tissue, bone and bone marrow, there we will see Nasa Bhango Akshiraga Chokshate Krimi Sambhava Bhavet Swara Upagato Aya Asthi Majjaha Ashrite. So when Kushta is getting deeper invaded in Asthi and Majja, there we will see bony erosion of nasal septum. So the first bony erosion of nasal septum's symptoms is common in majority of the patient. When we do the CBDT scan or CT scan, we find bony erosion of a nasal septum. So many people have dot mark or small very minute hole in the complete nasal septum. That is the Nasa Bhango. Akshiraga, blood discoloration in the eyes, redness of the eyes, that we will see if the orbit involvement of mucormycosis is there. Then we see osteomyelitis in bone around the sinus. So Nasa Bhanga, here we can take two reference. One is bone erosion for Nasa Bhanga, another one is osteomyelitis in the bone around the sinus. So this both we can take as a Nasa Bhanga. Then Swara Upgata. So laryngeal mucormycosis. So in majority of cases, mucus spread from nasal root to upward, that is orbit and brain. If it is going downwards, then we will see the voice box is getting affected, larynx is getting affected. So that is a laryngeal mucormycosis. And lastly, necrosis. So these are the Asthi Majjagat Kushta. We can feel that Sushruta has written this slok after seeing the patient of mucor only. This is also most important. Kafaja Krumi, again from Sushruta Uttara Tantra, where he has written Majja da Netra Ledharas Talu Srota Bhujas Tatha Shiro Hadroga Vamathu Pratishyaya Karachah Te. So here Sushrut tells what type of Krumi is Kafaja Krumi. So which the Krumi which eats Majja. So they eat Majja or bone marrow. Here Majja we take a bone only. So bone erosion and osteomyelitis. Then netra ledharas talu. So it leaks the eye. So literally they eat the eye. You feel the disease. They eat the eye, Krumi. So what happened there? There will be orbital cellulitis, there will be optic nerve damage, or there will be cavernous sinus thrombosis. These three findings are common in majority case of orbital mucormycosis. Then it eats pellet. This is also very common. We will see photo when Krumi eats pellet, how its clinical presentation. Okay, so this is the Kafaj Krumi. Again, we can compare with modern mucormycosis. Dushi Visham. This is my personal view I have taken. Dushi Visham tu Shonita Dushtayaruhu Kitima Kosta Linga Visham Ekekam Dosham Sandushya Haratyu Sevanam. So Dushi is an artificial poison. By combination of two non-poisonous material we combine, then third product that is getting formed is Dushivisha, what we call. So that vitiate the blood and produce the symptoms like Aru means eczema, Kitiba means psoriasis, and Kotha means urticaria. So here we usually understand kotha as urticaria, that is an external manifestation. Shit pitta like a manifestation when we see on skin, we understand it as a kotha. But same thing if we apply internally, understand. So this kotha can be seen in mucosal thickening. So 99% case of mucormycosis, when you do the CT scan or MRI, this yellow color words are common: mucosal thickening in bilateral sinus. So this is the kotha. Okay, we usually understand the kotha means external manifestation on the skin, but by applying our yukti, we can see it as internal manifestation in the body. So that is the mucosal thickening. This is the reason I have taken Dushi Visha here also for comparison, because steroid is overuse of steroid is one of the reason in so many research paper modern people have told. So we can compare Dushi Visha as a steroid, and ultimate result is mucosal thickening in bilateral sinus. Okay, so Rakta Jakrumi. There are I have 6 to 7 dentist friend. We work together by understanding pathology, anatomy, pathophysiology, everything. So what they found is a high D dimer when the person get COVID. At that time, D dimer level in the blood increase too much. So increase in the D dimer level means disturbance in the blood clotting mechanism. So once the D dimer is increased, there will be disturbance in the blood clotting mechanism. So what happened? There will be a chances of thrombus formation in the nasopalatine artery or sphenopalatine artery. So once there thrombus development is occurring, there will be a necrosis, because thrombus is there means there is no new fresh blood supply. So there will be a necrosis. Once the necrosis is happening there, then there will be a media, favorable media for fungus growth. There in that media, fungus is getting growth. So this is the anukul vatavaran. What we see prakruti vigat in the krumi chikitsa. Opposite to that happen here. Fungus get the atmosphere which is suitable for them to growth. Understand? So this is the hypothesis given by the dentist friend, that it grows in the blood vessels only. Same reference we find in Charak Chikitsa Sthan, 7th chapter 11th slok. This is the first two words of the slok. Sthanaha Rakta Vahini. We find very rare, very few or one or two disease where the location of disease is explained in the blood vessel. Raktaj Krumi in one among them. We don't find Kushtha as happening in the Rakta Vahini or blood vessel. We don't find Rakta Pitta happening in the blood vessel. We find only one classical reference where Krumi is happening in blood vessel. So this is the reference. Charak Chikitsa 7th chapter 11th sloka. So the Charaka, what Acharya Charakacharya has given the view about this location of the Raktaj Krumi is in the blood vessel. Same view is a hypothesis given by the dentist community. So it is the intelligence of our Acharya Charaka, we can see. So this is the Samprapti or pathophysiology. This is how this happened according to modern, and same reference we find in our classics also. Raktaj Krumi. So that blood vessel in that Raktaj Krumi is happening. So what are the symptoms? So Charak says in Viman Sthana 7th chapter, Kesha Ashma Ashru Nakha Loma Pakshma Upadhomsa. So these all things fall. Pranagatanam cha Harsha Kandu Toda Samsarpanani Ati Vruddhanam ta cha Tvaka Shira Snayu Mamsa Taruna Asti Pakshanam iti. Okay, so when the Raktaja Krumi getting lodged in the blood vessel, what it will do? It will get the failing of the hair, beard, mustache, nail, body hair, and eyelashes. Same presentation majority we see in the mucormycosis. Okay, so at that time, if we are not treating the krumi, then they will infect further and they will create a wound. So what they will do if they create the wound? Person patient will have oversensitivity, itching, piercing pain, and creeping sensation. So they will be having this particular area. This presentation will be there. They will say here patient is feeling numbness. They are telling there will be piercing pain, creeping sensation. All the patient present with the same complaint. They will say here is oversensitivity, here is piercing pain, there will be creeping sensation. This all common complaint in all kind of patient in a mucormycosis. So this is a typical feature of Raktaja krumi. Okay, if we are not treating krumi in that avastha, then they will go further invasion. They will do in deeper tissue. So what they will do? They will eat away the skin. They will eat away the blood vessel. They will eat away the ligament. They will eat away the muscles, and they will eat away the cartilage. Taruna asti bhakshana miti. So this is the osteomyelitis. Okay, so this is the reference that we should feel that Charokena Sushruta Maharshi has written this sloka by seeing the patient of mucormycosis only 3000 years back, because 100% typical feature are available in the classic. One more thing in Charak Chikitsa Vimansthana, where he explained types of Kafaja Krumi. In that one type of Krumi he has mentioned is Saugandhik type of Krumi, that place specific that grows in the nose and eyes. So these are the mucormycosis in Ayurveda. We find a great reference. Okay, so by seeing those six point, we have sufficient evidence, or we can say confidently that mucormycosis is nothing but Krumi Roga mentioned in Ayurveda 3000 years back. So all are waiting from this treatment what I am using. Okay, so we will go to the treatment aspect. We have finished how to correlate and what all. Okay, so when we hear Krumi Chikitsa means everyone have this answer. Upkarshan, Prakruti Vigat, Nidan Parivarjan. Because this is the 2 marks question in exam, Krumi Chikitsa. Okay. So Upkarshan is doing Sanshodhana. Here we have to exclude the Anuvasana Basti because it will increase the Kleda in the body, and Kleda is the Nidana for Krumi Roga. Okay, so we will do 4 karma here. Asthapan Basti, Vaman, Virechan and Nasya. We have to exclude Anuvasan Basti because it will clear the Kleda. Then Prakruti Vigat. We create such an atmosphere in that Krumi doesn't survive. That is the Prakruti Vigata. By okay, then Nidana Parivarjana. We have to avoid the positive factor. For example, we have to avoid unnecessary use of high dose of steroid. Try to get treated with Ayurvedic medicine for chronic disease or also for acute disease. Okay, so these are the Nidan Parivarjana, three basic treatment according to Charaka. Okay, so here from here onwards, I will be speaking 100% practically. Here, first herb I use is Vidanga. Okay, so we found the shloka in Charak Chikitsa, Kushta Chikitsa. When you this shloka, most probably most of the student we are not going to this shloka. This is the when the seventh chapter is getting finished. There 3 to 4th shloka from back. There is one shloka. Panahar vidane prasechane tupane pradehe cha kruminashanaham vidanga vishishyate kushtaha khadiraha. So in Kushta Chikitsa Sthana 7th chapter, Charaka explains that for Kushta, if it is not caused by Krumi, then we have to use Khadira bark powder or Khadira Tvak Churna for water, food, or Dhupana Dravya or any other way for external application, internal, basti, wherever you use, but use maximum Khadira. There he had one line, if Kushta is caused by the Krumi, understand, Kushta is caused by the Krumi, that is mucormycosis, then we have to use Vidanga instead of Khadira. So we use around 300 gram of Vidanga seed churna per month. That is this much high dose we give to the patient. So this 300 gram of Vidanga we give in the form of water as a medicated water and to add in the food. Like we add salt, masala, like that we use the, I advise patient to use Vidanga in there for this food. So for medicated water, I ask patient to take 2 liter of water, then add 5 gram of Vidang churna, then boil 10 to 15 minutes. Then without filter it, patient has to drink this water whole day. Whenever patient getting thirst, he has to drink this water after food with medicine. This water only they should take. So this is the Vidanga 300 gram per month we must use to get the result. Another important herb is Pallataka, that is marking nut, Semicarpus anacardium. We found one shloka in Charak Chikitsa Rasayan Adhyaya, Kafajo no sa rogo asti, no vibandho asti, kanchanah, yam na pallatakam anyas chikram megha agni vardhanam. So Charaka in Chikitsa Sthana says that there is no Kafaj Vyadhi or Avrodha which cannot be cured by use of Pallataka. Okay, so this is the Ushna Virya Aushadhi, and Krumi is caused by too much Kleda. Okay, so this is the extensively Pallataka I use in high dose. So where I use Ballataka, we use orally as well as in Dupana or for application in the oral cavity. So it can be used in orally. So orally we have a Serencota Nei capsule that is available from SKM Siddha Pharmacy that I give one capsule TDS. Okay. And for Dupana, I use 50 to 60 gram or even 100 gram Shuddha Ballatak Churna for Dupana. And for oral application, how we can apply orally Ballataka? So same the Serencota capsule which is available from SKM Siddha Pharmacy. We have to prick that capsule with a needle, and there, yes sir,
So can you please name the capsule name, sir?
Serencota nei, Serencota nei,
Can you please tell the spelling of it?
Serankottainei. Serencota, I think Tamil name for Ballataka. Okay.
Serankotta Nai, I think
Yes.
it is also advised by Ayush, one of the medicines which are included in Ayush prescriptions. Serankotta Nai. Nai is
Yes.
I think ghee itself.
Ghee, yes, yes.
Yeah.
In that 94% ghee and only 6% Ballataka is there. So by pricking that capsule, that ghee we have to put on tongue and we have to ask patient to apply that in the upper palate. That I will show the picture next how to this apply.
Yes, sir. Please
Okay,
continue.
so this is the Ballataka. We have seen Vidang, we have seen Ballataka, then we will see Palacha. Okay, next. Okay, Palacha. So Palachastu Kashayo Ushnaha Krumidosha Vinashanam Tad Bijam Pama Kandu iti Dadrutvak Dosham Nashakru. So these are all the reference of mucormycosis only. Krumi is a mucor, Pama Kandu Dadrutvak Dosh. This we should not see only Dadru means external manifestation on the skin. We can also apply the same disease in internal, which we cannot see by our naked eye. Okay, so this is the use of Palach in the mucus. Class Rajnikant from. Okay, so here is the ratio. For fumigation, we are using Vidanga, Palasha, Pallataka, and Nimapatra. Okay, so Vidang I have told 300 gram for oral use and 100 gram for Dhupana. So we will take 100 gram Vidang Churna, we will take 400 gram of Palashabiji Churna, Pallataka by seeing the severity of the disease 50 to 100 gram we can use Pallatak seed Churna. Nimbapatra we can use for some patient if it is available. So by combine all the herb Vidang, Pallash, Pallatak and Nimbapatra, we will do the Dhupana or fumigation that we can do with a cow dung cake or Upala. Okay. For some very critical patient, if patient is the we are not getting the result for with this, then we can add Dushi Vishari Agada or Vilvadi Gulika. So 100 tablet per month by making crushing into powder, we can use in that combination. Okay, if it is a pulmonary variety of mucormycosis, then in above combination Vidanga Palash Pallataka, we can use Pushkar Mula Churna. If it is a pulmonary mucormycosis, okay, if it is not pulmonary, then Vidang Palash Pallatak is enough. If it is pulmonary, then we should add Pushkar Mula Churna in that. So in Ayurveda, we have all read the Basti is Ardha Chikitsa for Vata Vyadhi. So based on my experience, I have here given new slogan. Dhupana is Ardha Chikitsa in mucormycosis. So simply if you do Dhupana with a good quality of herbs, Palash, Vidang, Pallatak, then also you can get a excellent result. No need of oral medicine. Okay. So these are the your half treatment is here only. If you do the fumigation exactly with a proper method, 1 hour in morning, 1 hour in evening. So I told this Ardha Chikitsa, Dhupana is Ardha Chikitsa for mucormycosis. So here is the ratio. Ideal ratio for Dhupana Dravya, Palasha seed we have to use that is 400 gram per month. Vidang seed powder, Vidang Bij Churna we will use 100 gram per month. Bhallataka from 50 to 100 gram we can use, we can decide by patient's power. Dushi Vishari or Vilvadi Gulika, we will use 100 tablet per month. That we have to crush and make it powder and add into that combination. Okay, so how patient will take the dhupana? So after creating the dhupa, patient will take 3 to 5 minutes from nose. They will inhale from nose and exhale from mouth, and vice versa. Like that, 3 to 5 minutes they will do. Then 3 minutes they will take dhupana fumigation in the oral cavity. By keeping mouth open, they will take this smoke on the directly upper palate. Okay. So and after finishing this, in that room, patient has to sit 30 minutes. We can make a dhup like agarbatti in that room, and patient will sit 30 minutes in that dhupa. Okay. And if patient is coming to Ayurveda when their eyes is removed, then also we can give at least 40 to 50 seconds this fumigation in the eye socket. Nothing is happening. We have tried in 10 to 15 patient. All are getting a result. No problem, no headache, no nothing. So they once eye is removed, we have to give dhupana there also. So it will prevent recurrence of mucor. And main drawback of this mucor is recurrence rate is very much high. Within 6 to 7 days of discharge, they get again the same symptoms. Okay. So, what practical issue we can face when patient is taking dhupana dravya? So we see this is the COVID complication. So in such some patient, oxygen is not normal yet after discharge also. So in that patient, they get severe coughing after taking fumigation, and in normal person also they get too much coughing. So what we should do? We should give dhupana from some far distance, or we divide in means less. For example, if you give 30 minutes in morning and 30 minutes in evening, then you give 15 minutes morning, 15 minutes afternoon, then evening, and then night. You do divide the dose. But dhup is compulsory. There is no compromise with dhupana. As this is the ardha chikitsa for mucormycosis. So this is the trump card for mucormycosis. Bruhat Vat Chintamani Ras. All might have confusion. This is the Raktaj and Kafaj Vyadi. Then what Vat Vyadi drugs I am using. Okay, so we will go deep here. So Bharat Besi Ratnakar fourth volume, Bruhat Vat Chintamani Ras. It contains Suvarna Bhasma 3 parts. It has Ropya Bhasma 2 parts. It has Abrak Bhasma 2 parts. It has Loha Bhasma 5 parts. It has Praval Bhasma 3 parts, and it has Parat Bhasma 7 parts. Okay, so in Ayurveda we find very rare formulation which acts upon both Vata and Pitta. Vayu is Shita and Pitta is Ushna. So if you treat Vata, it will increase the Shitata, and it will. Both are having opposite quality. Vayu and Pitta. Vata is cold in nature. Pitta is hot in nature. So very rare formulation we find which acts on both Vata and Pitta. So here we use Pallataka, Hartal or arsenic compound which is very Ushna, Tikshna and Ushna Virya. So here this is the balanced formula. You see Ropya Bhasma is there, Praval Bhasma is there, Moti Bhasma is there. These three is a very coolant in nature, Shita Dravya. So when we use Pallataka, some Pitta Prakruti patient may give some reaction. When we use Hartala, when we use Malla Sindur like the combination, there we may find disturbance in the pitta. So using of Bruhatva Chintamani will prevent the disturbance in the pitta. This is the one reason why I use Bruhatva Chintamani. Next slide we will see main reason for using of this Bruhatvat in the mucormycosis. Okay, in Ashtangradaya when we see 11th chapter, I think there Vayu Prakruta Karma is mentioned. Normal function of Vayu. There we see Unmesh and Nimesh. Opening and closing of eyelid is the function of Vata dosha. When Vayu is in normal state, it does the Unmesh and Nimesh. Opening and closing of eye is purely due to Vayu when it is in normal state. Okay, so what happened in progressive case of mucor, extension can be seen in the orbit, and majority of patients develop ptosis, that is the dropping of eyelids, and or proptosis, that is a displacement, abnormal displacement of the eyeball. So when we use Bruhatvat Chintamani from in your first day, we prevent these symptoms. Understand? Because this is the karma of Vayu, getting open and closed eyes. That is the karma of Vayu. And in majority of mucor patient, we see this development too, ptosis and proptosis. So when we use Bruhatva Chintamani from first day of the treatment, we hardly see our patient getting ptosis or proptosis. So here I have written rarely any patient develop above issue while taking Bruhatva Chintamani Ras. And when we compare in modern science, then majority of patient who is receiving modern treatment has an issue related with the eyes. Any patient you go in hospital modern who is receiving IV antifungal, or there maximum patient you will see ptosis or proptosis. But when you see the Ayurvedic patient, hardly you will see the patient who have eye involvement. Okay, so this is the another reason Bruhatva Chintamani. Okay. Third reason, Bala Brahmsa and Indriya Brahmsa. That is again the Lakshana of Vayu Prakopa in Ashtanga Hridaya, it has told in 11th chapter. So here Bala Brahmsa and Indriya Brahmsa. Considering brain as the Ubhaya Indriya, in severe critical case, intracranial involvement can be seen. Okay. In such case, we see Indriya Brahmsa. Okay, so when mucor is spreading from nasal mucosa to orbit, then from orbit to this brain, we see the Indriya Brahmsa. Patient will be slurred speech, or they get palsy of cranial nerves, or they get the brain related any issue. So this is the Indriya Brahmsa, what we call brain involvement of the mucormycosis, and that is caused due to Vata Prakopa. So using of Bruhatva Chintamani also prevents such condition. Same here, very minimum number of patient has brain involvement while taking Bruhatva Chintamani Ras, and many patients who is receiving modern treatment has brain involvement. So here also those who are taking Bruhatva Chintamani from day first onwards, we see very few cases they have brain involvement. And when you compare with modern medicine, majority has the brain invasion. And Suvarna, that is gold in Bruhatva Chintamani Ras, that does the Rasayan Karma. So these are the in-depth practical aspect I found while using Bruhatva Chintamani Ras. So this is the main reason Bruhatva Chintamani is compulsory for all the patient of mucormycosis. Let it be any variety. Krumi Kuthar Ras. Now we doctor we hear Krumi means this is the first medicine we get in mind. Krumi, okay, Krumi Kuthar Ras. Main thing is this doesn't contain Vedanga too much. This has more of Palashabija Churna, that is equal to all the other ingredients combined together. Okay, next. In Krumi Kuthara, Palas is more, Vedanga is less. Another one is Krumi Mudgar Ras. It has Parada, Gandhaka, Ajmoda, Vidanga, Vishtinduka and Palashabija. In here also, Palas is more than Vidang. Okay. I will tell why we are using all together. Some might have question why use Krumi Mudgar and Krumi Kuthar together. Why not use one in higher dose? So I will tell reason next. Asthi Poshak Yog. This is the compulsory formulation we must use in all the cases of mucormycosis. Why? Because bone erosion is the common in almost all cases. I have said Nasa Bhanga is Asthi Majjagat Kushta Lakshana. We have seen in Sushruta reference. And Asthi Majjagat Kushta. So to nourish this Asthi Dhatu, we must use Asthi Poshak Yog. So these are the three medicine I use based on availability. Asthi Poshak Vati, that is from Dut Papeshwar. This I give once a day tablet. Boniil tablet from Emil Pharmacy, that is also one tablet per day. And third one is Calci Plus tablet from Kerala Nagarjuna. That I give one tablet BD. First and second OD. Big size tablet.
So you are giving all these three together?
No, not together. Whichever one is available based on availability, not together.
Okay, only one among these.
Okay, so this is the most common feature. Again, getting abscess is the very common in majority of the cases. So abscess is, we can say, Abhyantar Vidridi in the Ayurveda. We will see the treatment of this. Okay. So Kajali is here drug of choice for Abhyantar Vidridi. We find two reference in Rasatarangini, use of Kajali in the Vidradi, Amik Prayog. Varunadi Kashayana Kajali Parishilata Bahya Antaha Vidradi Koram Vinivarayet. So here Varunadi Gan Kwath you can use, or Varuna bark powder, Varun Twak Churna we can use. Then another reference is Triguna Bali Yoga Kajali Slakshna Churna Satatam Iha Hi Lida Shigrutvam Agresena. So we have two references in Ras Tarangini, use of Kajali with Varun Tvak or use of Kajali with this Shigru Urswares or Shigru Tvak. Keshwar Gugul also can be added if too much abscess symptoms we find. Okay, and Kajali is the drug of choice in any kind of abscess. Going out of the topic, we had one case of liver abscess where we have cleared 450 ml of abscess, almost half liter of abscess from liver with use of Kajali only. Not a single antibiotic use, not a single painkiller, no operation. We have treated 100% with Ayurveda. Almost half a liter of liver abscess we have cleared with Kajali. Same Varunadi Kwath with Kajali and Shigru Kwath with Kajali. Okay, so how we will give? We will take 10 gram of Varun Tvak Churna, then we will prepare a kwath. At the time of drinking, we will add 250 mg of Kajali. It can be increased up to 1 gram depending on the condition. So in morning we will give Varun Tvak Kwath with Kajali, and in evening we will give Varun Shigru Tvak Kwath in evening with Kajali. Again, if you are giving 1 gram Kajali, then either in morning or in evening only 1 gram Kajali we will give. We will never give 1 gram in morning and 1 gram in evening. It will be high dose. Okay. So either we can use Varunadi Kwath also. If Varun Tvak Churna is not available, then Varunadi Kwath we can prepare and add 250 mg Kajali, then patient has to drink. This is compulsory for any type of Vidradi. And a practitioner can use this formulation in any kind of abscess. Breast abscess is very common in practice. Anorectal abscess we see in GI tract abscess. Excellent result we get with this formulation. Another one most important yoga is Vyadhi Aran Ras. This is also classical medicine. A reference is Rasendra Sar, Rasatantra Sar and Siddha Prayog Sangraha, first volume. It has 6 ingredients: Shuddha Parat, Shuddha Gandhak, Shuddha Somal, Shuddha Hartal, Shuddha Manasil, and Rasa Karpur. So I think only one classical indication or classical falsruti in only one formula we find is that Asthigat Vish. Now please highlight, sir, Asthigat Vish. Asthigat Vish. So the deep-seated toxins in the bone. So I think this is the only one formula. I have read so many books. Only one formula I have come across that has falsruti as Asthigat Vish, where the poison is situated in the bone or bone marrow. Vyadhivaran Ras is drug of choice. We have seen Nasa Bhango, we have seen it when we see Krumi eating bone and bone marrow tissue. Okay, so why not consider it is as a Asthi Visha? And I have used Vyadhivaran Ras in that, and I am getting excellent result. What is the dose? The 2 gram or 5 gram per day. Okay, if it is too much bone necrosis or too much osteomyelitis is there, then we can use 5 gram per 15 days, or we can use 2 gram per 15 days. In simple, this is the broad spectrum antifungal as well as antibiotic. So here I would like to add, we see many cases of avascular necrosis in the practice. So again here you compare this avascular necrosis with Asthigat Vish. We see steroid-induced avascular necrosis. After COVID, I have seen 4 to 5 cases of AVN who doesn't had any history of falling or anything. But when we asked, they said we have taken steroid for COVID, and there will be AVN, avascular necrosis due to steroid use. So that also you can consider it as Asthigat Visha, and doctor should use Vyadhivaran Rasayan in avascular necrosis. This is again research area. This is required. Another one is Pranopahari Ras, same reference, Rasendra Sar Sangraha and Siddha Prayog Sangraha. I think this formula not nobody came across. So it has four combination. Rumigna Vatika, it has 4 ingredients: Lasuna, Hingu, Vidang and Palas. All the Rumigna Dravya. Okay, so earlier I have said some might have some question why to use Krumi Kuthar Ras, Krumi Mudgar Ras, Krumigna Vatika, Vidang and Palas all together when it has same thing in their composition. So in first slok of treatment I have said one slok from Charak Chikitsa where he says if Kushta is happened due to Krumi, we have to use Vidanga as much as possible. So to maintain the highest concentration of Rasagun Vijaya Vipak of Vedanga in the blood, we use Vedanga Palasa in maximum dose. Person is eating water, it will be with Vedanga. If he is taking food, it will be with Vedanga. If he is taking any medicine, it must be having Vedanga. So this is the reason. 24 into 7, we must keep highest concentration of Vedanga in the blood. Then only this disease can be tackled. Otherwise, too much dangerous. Another very much important drug for eye involvement in mucormycosis, Palasha Anjan. This is the eye drops. Okay, so ingredients is the only one thing. Palash Mool Arka. This is the Kalera Pharmacy Rajasthan is preparing this. In mucormycosis, a good result is seen in every condition where eye is involved. No matter what kind of eye manifestation is there in mucormycosis, Palash Anjan, Netra Sudarshan or eye drop we are using for all the patient. This will prevent the further damage to the eyes, and it will also prevent the invasion of the mucor in the eyes. So this is the very much important. The use of Netra Sudarshan Arc result I will show in next patient photo. So okay, this is the drops. So what and all drugs I am here saying is major is the common protocol for all the mucor patient. FUOCL Fort, this is from Dudh Papeshwar. It has Tribhuvan Kittiras, Sudshekharas and Mahasudarshan Churna. This is to be used in nasal blockage, severe headache and nasal discharge. If by giving all the medicine, patient is still complaining there is a nasal blockage or headache or nasal discharge. Nasal discharge here is without foul smell or simple discharge. Then only FUOCL Fort will work. So that time we have to use FUOCL Fort. Okay. Gandhak Rasayan DH. DH here is double strength, high dose of Gandhak Rasayan we give. I use I think in SKM SDM Udupi pharmacy I think. They prepare a big tablet of this Gandhak Rasayan DH. 1 TDS I use continuously. Okay. We see use of Nimba, but where exactly we find the reference of use of Nimba in this kind of patient, mucormal like presentation. So when you read Charak Chikitsa, Kushta Chikitsa 7th chapter, where there he has written, Prapastastu Lasika Prastuteshu Gatreshu Jantukneshu Mutram Nimba Vidange Snana Panam Pradehascha. Okay. If Krumi is eating the tissue and due to this, if there is a pus discharge, and this in this type of Kushta, Vidanga, Gomutra and Nimba should be used in Snana, Pana and Pradeha. So this is the common presentation in majority of the cases what Charakacharya has explained. If Krumi is eating tissue and due to this pus is getting discharged. So this is the common presentation in majority of the mucor case. There we have to use Vidanga, Gomutra and Nimba in Snan, Pana and Pradeha. Okay, so this is again a classical reference to use Nimba in mucormycosis. If you see Kaidev Nigantu, they have quality of neem leaves. It is Grahi, Pravalam, Nimbasya, Rakta, Pitta, Kapha Krumi. See Kapha Krumi it is here. Pustagnam, Vata Jananam, Netra Rogan Vinashayet. Netra Roga also here. Tadvat Patrani, Nimbasya, Vranagnani, Visheshata. Vran also they have mentioned here. Nimba as Dhupana. So in Bhav Prakasha we have the reference to use Nimba as Dhupana. So Nimba Patra, Vacha, Hingu, Sarpi, Salavanam, Sarchape, Dhupanasya, Vrane, Ruksha Krumi, Kandu, Ruja, Apaham. So Bhav Prakasha says Nimba Patra, Vacha, Hinga, Sarpi, Lavana and Sarchapa we have to use in Dhupana. In which condition? In Vrana and Krumi, Kandu and Ruja. So here Krumi and Vrana is there. So Krumi and Vrana is common in mucormycosis. So we are using Nimba Patra as Dhupana Dravya. This is also very much important and all patient must do irrespective of either their oral cavity is involved or not. This is compulsory. Nimba Patra Swaras Gandush. Okay. Gargling with neem leaf juice, fresh neem leaf juice without adding water. So what patient has to do is they have to gargle with the maximum time a patient can do. So many patients do 20 to 25 minutes. Okay. So this is the fixed protocol for all the patient of mucor. Those who doesn't have oral cavity involvement, it helps in prevention of the invasion of fungus, and in those who has the involvement of oral cavity, it will heal the lesion. So it doesn't mean the patient doesn't have oral lesion means they should not do Gandusha. They also must do to prevent the invasion from nasal cavity to upper palate. Okay, so here is a 60 patient has got complete cure in loosened teeth mobility, and all teeth which were getting loosened due to mucormycosis got normal with use of this gargling only. So what happened? Normally surgery is advised in such case. For example, if patient of mucormycosis going to the hospital and they complain teeth is mobility, I mean teeth mobility is there, then according to modern science, this is irreversible. This teeth cannot be again get strengthened. They have to remove upper palate, full part, gum, everything. But when we give them this gargling with a neem leaf juice gandusha, all the patient has loosened teeth get completely this strong. Understand? So this is the cheap. No patient has to invest. Simple. Everybody neem is available and excellent result we can get. And another use is cleaning of the whole root, which is created in critical case of oral cavity to nasal cavity. So what happened in upper palate? We find a hole. If upper palate bone is getting osteomyelitis, then it will be necrosis. Then there will be a hole in the upper palate. So when patient is drinking water, it will coming from the nose. Sinus tract will be formed. So we advise them to clean that whole root with this neem juice, neem leaf juice. Compulsory Danta Dhavana by Neem and Karan, fresh Neem and Karan. This is the compulsory for all the patient. Patient has to arrange a Neem or Karan from anywhere if they want to get healed. No compromise here. Even I don't recommend Himalaya, Dabur or any other Ayurvedic paste because all will be sweet in taste and Madhur Amla Ras is apathya in this Krumi Roga. So 100% neem or currants they have to use, not even Ayurvedic toothpaste. This is the very much strict protocol for all the patient, and then only we are getting the good results. Another external application here is use of Carvira Mula Lepa. Okay, so root of Carvira Nerium indicum we use. That also we have the reference in Sushru Chikitsa 9th chapter where he has written तद्वे अश्वंगे अश्वमारस्य मूलम लेपो युक्तम स्याद विडंगे समूत्रम स. So where kushta krumi is eating the tissue in such type of kushta, karvira moola lepa with gomutra and vidanga has to be applied externally. So this is the classical reference Sushruta has told where krumi is eating the tissue in such type of kushta, a karvira mool lep in gomutra with vedanga has to be applied. Next, we will see the photo, the lep, how we apply. Okay, here are the three patients. First and second patient are rhinocerebral mucormycosis, brain involvement. Third is only rhinomucormycosis. They have facial abscess in this patient we have. So you can see the first lady has some good roots. Second has dry root. Third patient has used a fresh root. You see they very much fresh, full green. So like this with after preparing paste with gomutra, we used to ask them to apply and keep it over 3 to 4 hours in morning. If brain involvement is there or brain abscess is there, fungal abscess in cerebrum is there, then we ask patient to do clean shave every second day and apply this lepa so that maximum absorption we can achieve. So these all are my patient. Okay, this is the pathya apatya in Gujarati language. Next, English will be there. This is Hindi again. Next, okay. So diet for mucormycosis main because any patient coming to Ayurveda means they will be having one doubt is diet. What diet doctor will provide in Ayurveda? This is the main issue all patient have. So after reading Lagutri and Bruhatri, Yog Ratnakar, Vangasena, I have prepared a chart by reading all the Pathya, Apatya and full. I have concluded this in this photo. Milk and any type of dairy product is apathia in this mucormycosis. We don't advise, we ask patient not to take milk, curd, paneer, cheese, any sweet prepared from this milk. Ghee is also contraindicated. very less disease has apatya. Kruta is apatya. Kshir also apatya. If you read the shloka in Sushruta Samhita, this Krumi Roga, Kshir is told as apatya. Understand? Jaggery, all types of fruits and its juice is apatya. Black gram apatya. Palak and other green leafy vegetable, all types of madhur and amla rasa, sweet and sour item are contraindicated. Any type of raw vegetable to contraindicated. Fermented item and item prepared from maida flour. Okay, this is to be contraindicated. Sugar drinks or energy drinks, this is contraindicated. Okay, so what to eat more so that we can get a good recovery? So garlic we can use more, red rice or brown rice we can use more. Uh, these two three sabji, 3 4 acharya have mentioned common. Raw banana 2 3 acharya have told pathya in Krumi Roga. So we ask patient to eat a raw banana sabji, this pointed guard sabji, patola. We use bitter neem leaves sabji prepared from bitter gourd, bitter leaf, honey, ajwain, carom seeds, barley. Camel milk is what I say is oral amphotericin. I say patient this camel milk is oral amphotericin. Or amphotericin is IV antifungal drug they give in hospital. So what I tell patient is camel milk has such an importance compared to means similar to amphotericin. You won't believe that in Gujarat, Sumul and Amul dairy are the largest dairy in the Gujarat. I think in India. 99% of their camel milk is consumed by my patient of mucormycosis. Oh, maximum patient drink half a liter, 1 liter, 1.5 liter camel milk daily. So
How
this
much
is
it,
the
how
sorry.
much it costs there, sir? 1 liter camel milk, how much does it cost?
No, I think 25 rupees 200 ml bottle is there.
Pretty cheap.
Uh, Maximum I tell patient if you don't eat anything no problem, but try to drink as much as possible camel milk. One more thing, I have majority of patients from Rajasthan also. So in Rajasthan, they get fresh this camel milk. After getting camel milk, within 5 or 10 minutes they get to drink. So I have observed one thing in Rajasthan. All the patient who is drinking means direct camel milk, they have the high success rate in very much less time. So this is the pakka camel milk is oral amphotericin. And other instruction apathia that's common for all the dishes. We have to eat only when we have good or proper appetite. We have to drink water only we have proper thirst. We should not hold the urges of urine, stool or any other natural urges. We should avoid day sleeping that cause kapha prakopa. Don't drink water or don't take a bath immediately when you are tired. This is the Kushta Nidana told. Majority of people do this mistake. After getting tired, after getting doing hard work, suddenly they will drink cold water or they will take bath. This is the Kushta Nidana. Don't consume cold air and always drink half boiled and cool water. This is the diet I have prepared and this gives good results. Okay, one more major symptoms we find in a patient who has the osteomyelitis in the hard palate. So this is the excessive salivation. Excessive salivation will be in such a way that all the this cloth will be wet. This much salivation they will secrete. So Kapha Krumi Lakshana is there for excessive salivation, and if Kapha Prakopa Lakshana in Ashtanga Hridaya, if we see Kapha Praseka Alasya Gauravam, I think in Ashtanga Hridaya Praseka is there. Kapha Prakopa Lakshana. This is the excessive salivation, and for this best medicine I have get result is Vibhitaka Phalatvak, the fruit rind of the Terminalia bellerica. From in within 48 hours, you see the excellent result. Within 24, 36 or 48 hours, maximum 48 hours, you will see the result. So this can be used in other condition also where we see in the practice the patient have excessive salivation from the mouth. So Vibhitaka Phalatvak, they have to chew every 2 or 3 hours little piece. So here I will be sharing results of my mucormycosis patient. This is a 61-year male patient post COVID mucormycosis. When he came, he has the complaint of loosened teeth in full upper jaw, foul taste from mouth due to pus discharge, that is due to maxillary bone osteomyelitis. And when we did the CT scan, it show maxillary osteomyelitis. This photo is the CBDT scan photo. The name of patient is shared with his prior consent here. Okay, so 14 June, we see the photo. Here we see the red mark. Behind the teeth, we see the blackish discoloration. That is actually abnormal. There should be a yellowish coloration should be there. So here black coloration suggests bone is osteomyelitis and it is necrosed. So we have right in development of necrotic osteomyelitis in the maxilla. So this is the CBDT scan report of 14/6/2021. So there is a blackish discoloration. This is the before treatment. Then after treatment, 5th of September, we see the new bone formation there. You see the red mark. See the first photo behind the teeth. This is the black mark. That is the necrotic osteomyelitis in lower part of maxilla bone. We see after there is a we see the new bone growth is there. So this is a completely impossible task for modern science. So the patient is interesting thing is patient is relative of one of dentist MDS. He has referred this patient to me, and he was shocked after seeing this CBDT scan report. This is not at all possible to form the new bone there. That is also necrosed bone. So this is the power. This is the Ayurveda Amrutanam. This is the nectar. What we see Ayurveda. So Ayurveda has the capacity to make the newborn growth. We will see it from another angle. Next slide. Okay, so here from down this film photo is taken. You see the black hole. Total length you see before treatment. Same photo, but this is from lower side. From after you see the new bone growth is there. You see the black mark is getting decreased. So this suggests new bone is getting formed with Ayurvedic medicine. And interesting thing is that this patient has received 100% Ayurvedic medicine from day one itself. He has not taken amphotericin, he has not taken IV antifungal, nor oral antifungal, not operation. Purely Ayurvedic result. This is okay. We will see next. One more newborn growth is there. Next. Okay, so here you see the lower rim of the eyes. In this you see the black dot, the arrow. This black dot, and in this after photo you see the black is the completely turned into white. You see the black dot there. First photo. Yes, there is the black dot. This is abnormal. Actually, there should be a white. So the black suggests there is also necrosis and osteomyelitis. After our treatment, we see here complete new bone growth is there. Shining white part you see. There it is not here in photo visible. It is visible in DVD. So we have put this. Okay, so this is the first case I want to show to everyone that what Ayurveda can do. We actually underestimate the power of Ayurveda, but this is the Ayurveda. So, what is the probable reason? What is the probable way that Ayurvedic medicine what Ayurvedic medicine did there, so that we find a newborn growth? So here are the two different photographs we have seen before and after. In before photograph, figure A was showing development of osteomyelitis in maxilla as well as lower canthus or lower rim of the eyes. That might be due to thromboembolism or because of the mucormycosis. In post-treatment, we see there is a new bone formation around the lower canthus or lower rim of the eyes. And also there is a new bone formation is noticeable in premaxillary area around the roof surface of maxillary anteriors that we see in first photo. In other figure, there are newly developed bone is differentiated. These changes are indicating that there is a revascularization in the arteries in maxilla as well as orbicularis oculi. So changes in the post-treatment photo can be easily seen in pre-maxillary area, root surface or maxillary anteriors as well as whole maxilla. This is what I explained you in previous photo. These all changes are due to new bone formation or due to prevention of the spread of the disease. But it is also the fact that all the changes are because of revascularization that might be seen due to greater palatine artery as well as remaining maxillary as well as facial artery. So this is the point. This is the place where Ayurveda exactly worked in this case. So we see the revascularization. This is actually impossible task according to if we say modern physiology. once the necrosis or vascularization is lost, there is not a 1% chance to get the revascularization in newborn. If you get revascularization also, then also getting newborn is a little bit difficult task. But Ayurveda did it very well. So this is the first excellent case I wanted to share. Next case we will see. Here, in before treatment photo, there is a dead necrous tissue is seen. That in you can see. See, this is the black mark. This is the necrosis, and the yellow part is there. That is the osteomyelitis getting. Okay. So this tissue is seen, which should be removed by surgical procedure. So if this patient goes to the hospital, they will do extensive debridement from this place. They will remove all the upper palate, including that part. But what we have did is without operation, with Ayurvedic treatment, medicine, the healthy mucus are seen around the defect. This is also same photo. Next this photo after you see, sir. See all the this detached. That all bone, necrous bone, that is detached. An important point is that there is no residual dead tissue along with any type of secretion. So when we when I talk with one of my MDS friend, what his words are, this kind of healing they should see after 1.5 years of oral cancer patient. After they do surgery, after they take radio and chemo, after that 1.5 or 2 years, this kind of healing they see full pink and reddish tissue. Ayurveda did it in 2.5 months only. So this is also proof that Ayurveda is a nectar. This report I won't read, but 40-year male patient. This patient has taken amphotericin, 180 injection of amphotericin B. Total 6 injection per day, like that 30 days. You will be surprised to know that cost of one injection is 8,000 rupees. Okay, 6 injection per day is a half lakhs per day charge, 48,000. And operation charge, room, hospital visit charge, doctor visit, CT scan, MRI, that is all different. So now you imagine the total figure. This patient has invested 180 injection he has taken. But what is the result? Zero. Everything was as it is. Okay, so this is the report. I think sir will provide PPT. All will take a look in detail. The result I will share in next slide of this patient. This is the same patient which means previous this MRI 180 injection. This patient too. Please observe the eyeball movement, lateral movement of eyeball. You see the lateral eyeball movement. See here this. I think all are getting. Now you see the lateral movement. See eyeball is not moving there. After 1.5 or 45 days, I think 45 days of treatment, his eyeball is moving completely 100% all right, which were getting stuck. This is the Vata Prakrut Karma, Bruhadva Chintamani Ras Karma, thing not visible due to this rotation. No, but I will send you both videos, sir. You can see in detail, no problem.
Sure, sir. It is very much appreciable. I mean, we can see that the eyeballs are not moving here and it's clearly moving.
So here MRI findings suggestive of changes of invasive fungal sinusitis, which involves maxillary, ethmoid and sphenoid sinus associated with underlying with bony expansion, erosion and this photo, sir, intracranial and premaxillary. So this is the anatomical area they have mentioned where they find fungal sinusitis. This is the before photo. 70-year female patient. This patient has intracranial involvement, so they have advised to do brain surgery. But due to economical weak condition, they have opted for Ayurvedic treatment, and we will see the result of this patient next. This is visible clearly. This is the 15th of June, first day patient visited. This is the necrous part completely. The eye you see is completely stuck. The eye is not getting open or not getting closed. So they have advised to do the surgery to completely remove this black area, and to the eye also they have to remove. So then we have started Karvira Mula Lepa with Gomutra. So this lady photo was only there in that Lepa Karma photo. So after 3 days of Lepa with Karvira Mula with Gomutra, we see the tissue is getting revascularization. You see the dead tissue is somewhat getting fresh blood supply. 2nd August, you see the almost 80% lesion is completely okay, and see the difference of eye in 15 June photo and 2nd August. Completely both photo seems to be difficult, but same lady. So this is the Karvil Mula Lepa. So what we found here is the patient when came with a chief complaint of post discharge, nausea and vomiting due to brain involvement, fever, headache and numbness over the cheek. So after this 30 days of treatment, what we observed is there was a numbness reduced up to 40 to 50%, and other symptoms were completely resolved. So in this photo, you can clearly see the facial abscess, eye improvement in the eyes. You can see progressive healing in the tissue infected with mucormycosis with an Ayurvedic treatment. So this again proves Ayurveda is a nectar. So this is a orbital mucormycosis. This is a proptosis, foiling of eyelid. You see the redness of the sclera. You see the retina lower part is completely white yellowish below the pupil, and you see after photo. So we use almost 2 or 3 ml drops per day. This netra sudarshan ark plus mool arka plus again krumigna dravya. We use arka into the eyes. So this is the result we see. Along with this, we use a common protocol: krumigna vatika, krumikutar ras, gandhak rasayan, then pathya, camel milk. Compulsory patient has to arrange from anywhere. Camel milk is there means a result, otherwise no result. So this is the rhino orbital mucormycosis result. This patient is not able to see because of optic nerve damage, because nerve cell doesn't have capability to means cell division doesn't happen in that. Patient is not able to see, but just observe the clinical presentation, changes in the clinical presentation. So again, osteomyelitis in the hard palate showing significant improvement with an Ayurvedic treatment. You see the 3/6/2020, this white dot is a future opening of the abscess of upper palate. If this case is not treated in this time, there will be a opening will be formed there. This white yellowish, right, and this is the complete swelling of bone, upper jaw bone there only. Yes. So this is the 3/6. Then we see 5/7. We see the opening is not there now, and swelling also decreased. This patient used to do 45 minutes of kavala with neem patra, fresh neem patra, without adding single drop of water. They used to drain this swarasa. Then you see 20 August, it is completely clear. What happened in this case? If this patient goes to hospital, they will remove the whole upper palate. So you see the image in the condition of patient. If whole upper palate is removed, there you can see whole skull there. So Ayurveda prevented him from undergoing surgery, and he is completely fine. Uh, Here also you see the recovery in with Ayurvedic medicine. 21 May, you see the slough tissue, which is osteomyelitis upper palate. 31 May, there is no slough tissue, it is getting cleared, and 19 June, it is almost 80 to 90% cleared. In this patient also, if this goes to hospital, they will do the surgery there. But without surgery, this is 19 June photo, and this is September. I think this patient has completely filled this hole. So what happened from this hole? When patient drink the water, water will go from this hole and it will come from a nose. So such a horrible this condition this patient face. Exposed and necrosed bone. You can see this yellow, right? Showing significant improvement with an Ayurvedic medicine. See the 5th day of treatment, the getting healed, and 11th day there is no bone visible. It means a new mucosa growth over there, and bone is getting a fresh supply blood. So this is Kajali and Vyadhiharan Ras we use extensively in this patient. Here you see first before MRI, it reads as imaging feature are highly suspicious for acute invasive fungal sinusitis and left orbital preseptal cellulitis. This patient received 100% Ayurvedic medicine from day 1 itself, and after this is from 4 June before photo, and after photo is from 2 August, I think. Yes. There we see the impression is radiological improvement is there. So mucosal thickening is significantly reduced, and the left orbital preseptal cellulitis was there. That is completely resolved. This is with 100% Ayurvedic medicine only. You see, they have suggest radiological improvement. Here also mucosal thickening were there. That is the most common. This is what we call Dushi Visha, Kotha, Shotha, sorry. Okay, this is the before photo, and after there is a very much mild mucosal thickening were left in only few sinus. Initially, it was in all the sinus. This is a lengthy report. I think you will you provide the PPT to the all the doctors. They will, I think, read. But
Sure.
you can see here no radiological deterioration in the present study and reduction in right orbital cellulitis and soft tissue edema. This, for me also it is not visible. It's okay, sir. You provide the PPT to the, all the doctors.
Sure. Sir. Yeah.
After this patient also underwent for 2 or 3 surgery, deprimant, face surgery in nasal mucosa, received amphotericin. Then also it has not, they have failed to control the disease. So after taking all the modern treatment, their report show increased bone marrow edema, inframedial extra and intracornal compartment of right orbit edema. So when after that patient came to us and we have done another report after our treatment, there we see resolving bone marrow edema and significant resolved right orbital inflammation. So this patient is still receiving the treatment. It was a difficult case, but still it showed the result. This is the first case in, I think, February end, 2011 February end. Since that I am treating mucormycosis. In this I have not studied that time too much. This much only result I was able to get. Just I was able to reduce the swelling of eyeball. You see, after this case, I have gone very deep in mucormycosis. Then started taking more and more case. This was the first case in February end 2011, 21. Sorry. Here you see the ptosis. The patient was not able to open his eyes. That is the before photo. After he was able to open the eyes. You see the inflammation, the cellulitis in the eye. We have again a video next. You observe the opening and closing of the eye. Forcefully he is trying but still not able to open the eyes. So this is the karma of Vayu, Unmesh Nimesh. This is hampered here. So he is not able to open the eyes. Okay. So after a treatment, you see. So Prakruta karma of Vayu is restored with Ruhatva Chintamani Ras. Simple. So here in before photo you see they have mentioned many anatomical area where they have find residual mucormycosis. Okay. After that receiving modern medicine, when no result was there, patient approached to Ayurvedic medicine. Then we do give the medicine. Then you see the 23rd August result. Non-obvious changes are seen related to active mucormycosis. So they have nothing to worry about mucor like that. So these are the results of. Actually, this is my first lecture in English language. I not much. I am not very much expert, but I have tried my best. If any mistake, please forgive.
We are here to, not to learn English. We are here to learn Ayurveda. So we are thoroughly enjoyed, and it's very rare to see, Ayurvedic treatments giving so much clear results in black and white. Like previously, there was this big infection, and it's completely healed. And also the new bone getting formed, getting vascularized. Some of the things, Mr. Carey Ayurveda Yoga and Thai Massage Center, the practitioner there is saying to you, much love to you, all of you, and thank you, sir.
Thank
And
you.
yeah, Amina Strategian says, thank you so much. God bless your hands. Rajnikant is, you might or might not be knowing, he's like a superstar in Tamil film industry. And
No, no.
here,
Sir again, Sushruta was superstar. They have written by saying patient of mucormycosis, Raktaj Krumi.
All credits definitely go to Sushruta Rajni. So, credit also goes to this superstar Rajni also, right?
No.
but
No, because
I have seen, I myself have observed, patients will be there with their symptoms. And in the textbooks, if we read, we'll get all the, matching symptoms and matching medicines and all those things. But requires a lot of courage to apply that as it is.
That's right.
Without
Yes, sir.
contaminating our mind with what will happen. Oh, this is mucormycosis. It's already fungus. It's so debridement is the solution. How can we treat?
Yes.
A lot of self doubt will be there. It really takes a lot of courage to at a young age to really back the samhitas, go back to the roots, learn the slokas, extract the meanings, and then apply it practically. It's so wonderful.
So we know Ayurveda was actually formulated. When it was formulated, it was one thing was underlined. It was for Adya Rogis, many things, and we also have Adya Roga. So current Adya Roga in 2021-22 is mucormycosis itself,
Yes.
and we know with this presentation that Rajnikant has saved not only lives but saved so much of money to the people, and he has also served the poor people and with simple yet effective remedy. So the formulations again were superb. I want to just add one thing. When Dr. Rajnikant said Dupana is half chikitsa, ardha chikitsa, I think this is the second best statement made after Charaka made that statement as Bhakti ardha chikitsa. Okay. This see to tell that you need a lot of guts. You need guts. You need heart. You need liver. You need everything. You need brain, working brain. Very importantly, on these platforms, when so many elite people are there, and like elite platform like Easy Ayurveda, maybe it's an international forum, or in many colleges that you are giving lecture to give a statement. Very important to give a statement. You need a lot of guts, and that guts comes from experience. And it is not just like that. You have said that Dupana is Ardha Chikitsa. It is with your efforts, with your observances. Dr. Rajni, this is not just a treatment or a presentation. It is research. It is the best research ever in mucormycosis. I personally found, and Dr. Janathan Hepper also said, a youngster like you doing that and leading the front like a leader. So flag bearer, as I already said, sitting from here, salute. Big
And
thing, big thing.
and there was a question that you were giving Dupana, Gandusha, Lepa, external Lepa, oral medicines to all the patients, like all the treatments were combined, like right? It's not
Yes.
like one.
Yes. LEPA is for selected person only who has the abscess or
Okay,
especially brain involvement.
okay,
Because
but
brain once is getting involved means we must be very much careful because in one day anything can be happen.
okay. Many comments have come. Sudha Nagarajan says, excellent session. Thank you for sharing this. Charu Mahajanji says, thank you so much. Amazing achievement. So lucky for the patients to have their care under you. Dr. Vijayalakshmi applauds. Wonderful session, sir. And there's a question here. How many patients have you seen?
Okay, I have I think more than 450 patients of mucormycosis.
Yeah, that's why I mean he got like really famous, and a newspaper called him like Mucormycosis ka enemy, like Mucormycosis ka dushman. So out of 450, did you see any failures or like?
No, what I have observed, what one note I have made is those patients who were operated in that we are facing much difficulty in getting the results and the recurrence rate is too much high in the operated case. This is my personal experience and I am telling with full confidence that the recurrence rate of mucormycosis is very much high in operated cases. Those patients, for any reason, though they don't have money, they have some other issue, they have not underwent for operation. In that, we are not finding recurrence. So, in those patients who is coming to Ayurveda after 3 or 4 surgery, in that even we require much difficult. We find difficulty in getting the result. But simple, maximum patient get best result. Condition is they have to follow strict Ayurveda. There is nothing like compromisation. I will not drink camel milk. I don't like. If they want to get healed means they have to drink camel milk. No compromise.
And also, I mean, what is the like average cost of your treatment on for a monthly basis?
Only Bruhat due to Bruhatva Chintamani treatment is getting costly and Palash Beach we are sometime getting from tribes of Dang forest. So we pay them good to get the quality this medicine. So exactly we can't, but 10,000 to 15,000 approximately maybe per one month. Because Bruhatva Chintamani, if you take from Dudh Papeshwar, it will be 4,400 30 tablet. 60 tablet per month means 8.5 thousand is over there. Vidanga is too much costly. Vidanga two type of available in market. I use 500 gram which has a 1500 rate, half kilo 1,500. So like that. But this is the 0.1% of what they charge.
Yeah, yeah. I mean, yeah, that is not even like a
Ah, ah.
two injections
Not
and
even 1%. Two injection.
Thank you so
somebody.
much for this excellent and amazing results. It's really totally amazing. I'm so impressed. I just
Thank
wanted to
you.
ask if in some of the other countries where not all the Ayurvedic herbs are available, would Nimbadi Kashayam with Vidanga as a powder inside a food help in case of mucormycosis in the lungs?
Yes, exactly. But if it is lungs, then try to find Pushkar Mula Churna. Vidang is okay, no problem. But you have to add Pushkar Mula Churna in the diet.
Very good. Thank you so
Clear?
much, Mayaji.
Yeah, I mean, in one of the slides, he has explained clearly that, I mean, which are the set of the herbs to be used. In that, he clearly said that if it goes
I have mentioned
if it goes to the bronchial route, then Pushkara
Pushkar Mula
Mula,
to be added.
and I think it should be available worldwide. Yeah, I mean, somebody asked for Dr. Vijayalakshmi ji asked for his contact details. I have sent it in the chat also. For those people who would be listening this to only in our podcast, his email ID of Dr. Rajnikant is KACHHADIYARAJNIKANT and his number is, I hope you do not disturb him directly, disturb him too much, but his number is 8095068938. And he's from India, so you have to add +91 as prefix. Joe Moran writes, many thanks to you, great doctors, for giving such relief to your patients and giving your knowledge to us. We take what we can and love you. So, I mean, though not all the Ayurveda products are available in Western countries, at least Kaishara Gugulu, Varanadi Kashayam, Palasha, all those things are
No,
Neem.
I said na Dupana is Ardha Chikitsa. They can get Viranga, they can
Yeah,
get Palasa online. Vilvadi
sure.
Gulika, Dushivishari Gulika, they can get. Why don't they start a fumigation with this? It is Ardha Chikitsa. You win
Yeah.
half disease there only.
So, no, there was another question like, do you also treat coronavirus cases?
Yes, we were actually treating, I were actually treating only serious COVID case. Those who are on ventilator, those who are on BiPAP, like that only we were treating. Simple case, that is without medicine also they can be managed.
Okay, so before we wrap up, Dr. Raghuram, do you want to say something?
Yeah, so I just wanted to ask Dr. Rajnikant, medicines are
Yes, sir.
available, herbs are available. Where do you get your courage from?
Charak Samhita. When I open my clinic, I see first Charak Samhita. I
Very,
will
very.
send my small library in tomorrow WhatsApp group. When you add me in your group, I will send books in surrounding. I sit all are the Ayurvedic books. That is the aura I get.
Dr. Hebbar is very fast in doing things. He might have already added you, so there's no doubt about
That
that.
I was
As
saying
a
in webinar also.
No, no, as I already said, doing
uh,
different, see, Dr. Eber, I know him since so many years, I know you since so many years.
uh,
You people have similar nature, like what I said, very infectious, very fast, very infectious in right sense, like
mm,
very workaholic. And one thing, camel milk, what you advised, Dr. Rajni,
yes,
that is apart from Ardha Chikitsa, Dupana being Ardha Chikitsa, camel milk with so much authority, authentication, you said camel milk.
yes,
I'm advising if nothing is possible, no diet is possible, just go ahead and drink camel milk as much as
yes,
possible. And
yes.
most of what Gujarat produces is used by my patients.
Ah,
Absolutely, that is cunning statement. Again, that is a second statement. Uh, where did you get the idea of including camel milk into the diet and making it very compulsory and stringent to the patients?
we read the Pathya Apatya. For example, Bhaishya Ratnavali in every chapter, last shloka is Pathya Apatya. I have read Charak, Sushrut, Bhangasen, Yog Ratnakar. Everywhere Kshira is strictly Apatya, and then in next line they say Ushtra Kshira Apatyanam.
No, no, no. But especially in mucormycosis, my question is in mucormycosis, though it has been mentioned
Ah,
as patya.
there might be something interesting story because in no other disease you find specific milk you have to take except mice exceed Nidra Jananam.
Is it quite raw, or do you ask them to process it, heat it, or do some
No, no, I don't have contact, but that is the only two dairy which is making available this camel milk. For Rajasthan patient, they are वो directly वो करके लेते हैं तो they have very much a good response.
अब जहाँ नहीं मिलता है, so wherever camel milk is not
This Sumul Amul bottle available online also.
online also. Okay, okay. So that they can procure it, isn't it?
So when one of patient of mine go to dairy, there will be a queue of another of my 10 patient who are waiting for taking milk carrot.
No, when did you find that it is giving a very good impact as a part of diet?
I think one patient from Rajasthan, when I advised him, he told in nearby his house there is this Gaushala we have like that camel they have 15 to 20 in Rajasthan. So he used to drink daily fresh, and compared to other patient, he has such a higher response.
Very good.
That is anyhow I have put in Pathya, so he has started drinking, but his result was quite exceptional.
So then you started advising it to almost everybody.
So this 50% Dhupan Chikitsa, 25% Ushna Dudh, 20.
One more point.
But it is perfectly working. Just in fungal disease, might be tinea infection. Why not we start advising patient to drink camel milk in tinea patient?
Super.
Common vyadhi we found.
It is clearly written that camel milk is ruksha, dry, ushna.
Krumigna. Krumigna also there, I think.
Usually Anaha, Krumi, Shofa, Udara, Asha. So I mean clearly Krumi is mentioned there. So
yes.
So we can. One more point I would just like to add and finish off, Dr. Hebbar, to what Dr. Rajni said. So we can speak for hours together. It's nothing.
So we can continue till 12, no problem.
No. So from my perspective, so there are so many things to tell, Dr. Rajni. One thing you mentioned, so people, what the mistake they do is they go and take immediate bath after getting tired and all those things.
Shita Ushna Utram 7 together.
Yes, in Kushtaroga it has been mentioned. I want to give one more quote from Sushruta itself. Similar this one condition, Ushnavitaptasya Jale Praveshad, he has mentioned in the eye disorders. See, it is so interesting. He mentioned skin. Ushnavitaptasya Jale Praveshad means when you come from sunlight or exposing to sun, immediately you go and take a shower or a bath. I think I feel it is Sushruta's reference, if I am not wrong. I'll just check and get it clarified. So it will affect the eye and vision is what Sushruta tells, and you are also treating the mucormycosis related to the eye. So this is also a patya and apatya. So if they are following it is apatya, if it is not followed it is patya. This is one reference I wanted to add to your slide.
Sure.
So thank you so much for your wisdom, and really enjoyed the total session. It was like a second show movie and very interesting movie with clean clinical presentation, everything spot on. Rajni, thank you so much.
Thank you.
Were the patients admitted or they were like?
No. OPD. They come, I examine, I give medicine, they go. Simple. No admission, nothing.
So they were doing this Kavada Gandusha etc. at home only.
Yes. I show them video on YouTube, Dhupana, like that. I send them link. Simple. I make them understand. Okay. So no IPD work, only on OPD based practice. That too in very small room. I have OPD.
One more clarification I want to give just before. I just wanted to give a clarification about Ushnavitaptasya Jale Praveshad. That is after getting exposed to sun heat or sunlight. I said it is Sushruta's reference. It is Sushruta's reference. Sushruta Uttara chapter 1. Sushruta Uttara chapter 1. First line itself. Chapter 1. First shloka. First line. So
it is very much important. First line. First shloka means.
In Uttara Tantra, first chapter, first shloka, first line.
Yes.
That is a confirmed this one reference. Thank you.
Okay, thank you everyone. Thank you, Dr. Rajnikant. And this
Thank you.
session was arranged live for only our webinar subscribers. If somebody wants to subscribe to our weekly classes, there is an option to join there. So we will see you in the next Saturday, and coming in the next Sunday also we have a session. So thank you everyone, and special thanks to Dr. Raghuramji and Dr.
Thank you.
Rajnikant Patel sir.
Thank you.